Welcome, my name is Curt Chaffin. I'm one of the allergists here at the Allergy and Asthma group of Galen, and we just want to talk a little bit today about allergy testing. The first thing really to talk about before we get into allergy testing is what exactly is an allergy? Well, an allergy is a reaction to an allergen. An allergen is anything that provokes an immune response to a particular allergen. We're all familiar with someone who eats, say, a peanut. The peanut in that case is the allergen, and it provokes a reaction of maybe hives, itching, difficulty breathing, throat swelling. That's the allergic reaction. Now there can be lots of different allergens, obviously foods that we just mentioned, but environmental things, dust mite, cat, dog, pollens. You can have medications that are allergens. You can have stinging insects that are allergens. We're going to focus today on environmental sort of testing, and we call this sort of allergy a type 1 allergy. I guess the first question is, why would we do allergy testing? And I will go ahead and say that for many of our patients that come in, they may not need allergy testing. First thing to do is really to talk through what exactly happened, what sort of symptoms are ongoing, what sort of things have you tried in the past, and are we able to identify it without testing, or do we need to do some testing? Now, a good portion of our patients do need testing, but it's not a foregone conclusion that you're going to need testing. So why might we do allergy testing? Well, one is just simply to confirm what we think is going on, particularly with a food allergen. If we suspect there is a food allergy, we're almost always going to do testing. So if someone comes in and says, yes, I've eaten several different nuts and I'm not sure exactly which one's causing these symptoms, but every time I eat nuts I get hives for a few hours, then yes, we're going to go test the several different nuts to see, is that really what's going on? Is it a true allergy? And if so, are there particular nuts that we need to focus on? So getting a precise diagnosis, whether it's a food, which I keep talking about, but also with regard to pollens or mold, or is it a dust mite issue? If we can figure out what is causing the reaction, we can therefore focus the avoidance strategy and focus our treatment. I mentioned avoidance. It is common that people come in avoiding things that they think they're allergic to, and oftentimes we find that no, that's not what's going on. And so it's really nice to be able to kind of clarify what's happening. We can probably dispense with some of the avoidance that's not really helping, and then focus our efforts on what we do need to avoid. In the same way, if we decide to use any medications, we can focus the medications, not only the type of medication, but perhaps even the time. So if we know that it's a particular pollen that is setting somebody off, then we can focus our medications during that pollen season and perhaps relax the medications other times. Because of course, we do want to reduce medications as much as possible. We need to use them judiciously and use them consistently when we need to, but be able to back off of them when we can. So let me go through just what the process of testing looks like. And again, I'm focusing on what we call a type 1 allergy here. We have other testing for other types of allergy, but a type 1 is commonly referred to as skin testing. It is a two-step process. And the first step is simply to use some prick testing, where we have someone come in. On an adult will typically use arms. On a younger child will typically use back. You have a little bit of the protein of what you're allergic to mixed into a solution. And so we use simply a little toothpick to scratch the surface of the skin. Now, depending on what we're testing for, will be a different number of testing. If someone comes in typically with nasal symptoms for an adult, we're typically going to look at 40 or 50 different things. Most of those are different sorts of pollens: tree pollen, grass pollen, weed pollen, mold spores, cat, dog, dust mite. But again, we're going to tailor this depending on what your symptoms are and your age. Particularly with young kids, 2, 3, we're going to reduce that number as much as possible, but we do want to be as thorough as possible too. We'll do prick testing. Let's say we're doing this on an adult. We'll do it on the arms, and then we'll wait for about 20 minutes. And what we're waiting to see is any sort of mosquito bite looking sort of reaction. A little redness, a little raised, little what we call a wheal is that raised part. And we'll measure that, kind of record the size of that, and that will help us identify the likelihood of whether you have an allergy. Depending on what we find there, we may go on and do a second step on the upper arm, which again involves placing some of what you're allergic to, this time right under the skin, where we then wait again for a small little reaction to see if anything happens. If you're not allergic at all, there won't be any sort of reaction. So in conclusion, What we want to do here is to try to identify as closely as possible what is causing your symptoms. The better we can identify what's causing your symptoms, we can therefore tailor our treatment, whether it's avoiding what you're allergic to, whether it's using medications, or for some people, allergy shots for the long term to reduce their overall inflammation. So that's our focus here. If you have any questions at all, please do not hesitate to contact us. Thank you.